Well, thank you all for joining me today. You know, Republicans want to talk about anything except the healthcare crisis they created. Republican leaders would literally rather shut down the government than talk about how we need to act to prevent healthcare premiums from more than doubling. Republicans do not want to talk about families getting priced out of their healthcare coverage or skimping on prescriptions or missing out on preventive care or even life-saving treatments. They do not want to talk about the families they chose to kick off Medicaid in their big, ugly bill. And Republicans definitely do not want to talk about hospitals being pushed to the brink, even shutting their doors because of cuts Republicans passed to pay for billionaire tax breaks. Well, you know what? Too bad. Republicans can shut down the government, but they cannot shut down debate, and they can't shut out the voices of people across the country who've been staring down this healthcare crisis Republicans can't bear to look at. That is why we're here today. We are going to talk about what Republicans want us to ignore, because here is what is happening. Right now, healthcare premiums are being set for next year. And because Republicans have refused to act to extend those critical ACA tax credits, they are being set higher than ever. Families are going to start getting some eye-popping announcements in the mail about their health care rates this month. We are talking about the highest premium increases in years, and Republicans think they can ignore this? Here in Washington State, nearly 250,000 people rely on the tax credits Republicans are killing. On average, these families save $1,300 a year, and it's worth noting Republican districts have some of the highest rates of people relying on those tax credits. So Republicans are now shutting down the government because they don't want to help their own constituents. Think about that. And let's not forget farmers. 1/4 of them are covered on our exchanges. Let's not forget small business owners and workers and people who are self-employed. They account for nearly half of the people on the exchanges. But Republicans have refused for months to talk about saving these workers and their families from these massive healthcare price hikes. They actually voted down our efforts to fix this problem 3 times earlier this year. Instead, they passed a bill that gutted Medicaid, kicked even more people off coverage, and shutters hospitals across the country. It is so absurd, I almost get why Republicans are desperate not to talk about how much damage they've done. But families are facing higher health care bills, don't just get to ignore their new premium. Patients who have a prescription to fill don't just get to stick their heads in the sand. And hospitals that are now pushed to the brink can't keep their doors open by ignoring the problems Republicans created. Working families, small business owners, rural hospitals, they all have to face the reality of these Republicans' healthcare crisis. So as long as I have a spotlight, I'm going to keep it on the issues Republicans want us to ignore. As long as I have a platform, I'm going to amplify the voices Republicans are trying to drown out. And I'm very pleased today to have with me some folks here in Washington State who are on the front lines of this healthcare crisis. I'm going to make sure their voices are heard in Congress, and I'm going to keep fighting to get them the help it is so clear our communities need. Republicans may have chosen to shut down hospitals, and when we demanded they fix it, they may have chosen to shut down the government, but we're not going to let up. We are still at the table. We're going to stay there until Republicans work with us to reopen the government, fix this crisis they created at our hospitals, and stop healthcare costs from going through the roof. With that, I want to turn it over to Dr. Zonis. He's the Chief Medical Officer at Harborview Medical Center. Thank you for being with me today.
Thank you, Senator Mary. Good morning. My name is David Zonis. I'm a practicing general surgeon, and I'm proud to serve as the Chief Medical Officer for Harborview Medical Center, which is operated as part of the University of Washington Medicine Health System. I want to thank again Senator Mary for providing an opportunity to speak about this vitally important issue. Harborview's mission is to serve the most vulnerable patients in our community. We live that mission every single day by treating every patient who walks through our doors. The expiration of the ACA premium tax credits will have significantly negative impacts on our public hospital system and on all the providers that are caring for our patients. Most importantly, I, as a clinician, am very concerned about the clinical impact it's going to have and the direct impacts it will have to our patients, their ability to access care, the stability of our healthcare system across our state to continue to care for all of them. The financial hardship that is a result from these higher premiums that Senator Murray just referenced, or in many cases, loss of coverage altogether, will often force our patients to ration or forgo essential medical care, which will ultimately lead to worse health outcomes, and it increases the strain on our already stretched system. Our hospital in particular will face significant increases to uncompensated care because patients will become more uninsured or underinsured because of the higher premium costs that they just can no longer afford. Now, in addition to the loss of the tax credits at the end of this year, the major cuts to Medicaid will absolutely negatively impact patients that we treat at Harborview and really all safety nets. Harborview stands as Washington's leading safety net care hospital. 34% of our patients rely on Medicaid for their healthcare coverage, and another 5% of our patients are uninsured despite having Medicaid availability. So let me just provide a little bit of historical context of where we were and where we ultimately will be headed. Since the passage of the Affordable Care Act, Harborview's uninsured population dropped from 11% to 5%. But with the impacts of H.R. 1 and the expiration of the tax credits, we anticipate looking like we did before the Affordable Care Act with that higher uninsured payer mix. Many of our patients are already struggling to be able to afford access to healthcare. Now, these delays in their existing conditions will worsen because it will lead to them arriving with more advanced disease, more visits to our emergency departments, and higher risks of complications. And this ultimately will lead to a higher cost of having to care for patients because they're going to be sicker. Now, in addition, for patients who switch plans or have to drop their coverage, their continuity of care is going to be disrupted, which is particularly harmful for patients with chronic conditions who already have an established patient care team. So this will negatively impact the quality of the care that they receive, and this is really not what our patients are expecting of us. From a public health perspective, this is extremely concerning because more and more people will be accessing the care they need in our emergency departments, which further strains our healthcare system's capacity and will limit access to other patients who also need those services. These significant increases in the premiums, the uncompensated care, and the impending Medicaid cuts will put our ability to care for our safety net population in jeopardy. There's no doubt in my mind that this will worsen their healthcare outcomes and will make it far worse for those who can just no longer access the coverage and the care that they need. Again, thank you, Senator Murray, for the opportunity to share our voice, and I'll turn it to Dr. Palazzo.
Thank you, Dr. Zonis. And thank you, Senator Murray. It's good to be with you all. Good morning or good afternoon, depending on where you're at. I'm Dr. Ettore Palazzo, and I'm an internal medicine physician, actually trained at Harborview. Thanks for the work that happens over there. So proud of our Level 1 Trauma Center. I've been practicing for 2 decades at Evergreen Health, and I now have the honor of serving as the superintendent and chief executive officer for our organization here. Evergreen Health is a community-owned public hospital district here in Kirkland, Washington. We serve over 1 million residents in our total service area, which includes Northeast King County and South Snohomish counties right here in Washington State. I just have to say, as a public employee and as a publicly owned organization, it's very important for me to make it clear that healthcare delivery to our community is a nonpartisan, apolitical exercise for us, and I will double down on that. Our goal is to advocate for ensuring that our community has unhindered access to affordable care and services that they need close to home, regardless of where they fall on the political spectrum. For us, if the premium tax credits expire as anticipated, Evergreen Health is deeply concerned about the financial strain that it will bring not only to our community, but to the healthcare providers. And it's an ecosystem that's very delicate right now. When we talk about how we're delivering care to our community. These tax credits are especially important for many of our community, including older community members, business owners, self-employed residents. These same individuals will see, the greatest impact when, noting that their incomes make them ineligible for safety net programs, but still rely on these enhanced premium tax credits to make the marketplace coverage affordable for them. If and when they expire, these community members will essentially be caught in the middle, unqualified to enroll in safety net programs, but still unable to afford that coverage that they used to have. For us at Evergreen Health, along with other care providers, the impact on the community will have several consequences. And there may be some folks on the call or hearing this that will say, well, this doesn't affect me. I have great coverage through my employer, or maybe I'm Medicare age, and this is a separate issue for me. It's not impacting me. Dr. Zoni's referred to the fact that these same individuals, even though their coverage may go away or they're not able to afford it, their healthcare needs continue. Their diabetes, their cancer, their need for preventative care, and they're going to continue to seek care, and we'll need to find a way to do that for them. Coming to emergency rooms to get that care where emergency care for others are needed as well will stress the system. And I think the financial impact of this from charity care that will need to be delivered, and we do that now, we'll need to do more of that, the bad debt that comes with this at a time where the financial crisis for hospitals remains a reality. Operating losses across the state and what continues, and challenges that will come with Medicaid cuts will continue to be real for us. So when we look at this, the impacts of the loss are real, and the immense pressure on the entire ecosystem will continue. I would say that, for us, we're going to do everything we can to make sure care is there for our community and work through this. The bottom line is we're concerned, and I deeply appreciate the ability to speak on behalf of Evergreen Health, on other healthcare organizations. And at this point, I'll go ahead and turn back over to Senator Murray.
Thank you. Thank you to both of you. And Dylan, I'll let you call on press.
Great. We've now got time for some questions from press. If you have a question, please raise your hand, or you can message if that is not working. We will go first to Eric with Bloomberg.
Am I unmuted? I think so.
You got it. Yep.
Senator Murray, I saw your tweet earlier about the Russ Vought firing threats. Would it be right to say that you guys are sort of dismissing that as a sort of an empty threat, or just posturing, and that you're going to continue to go this fight? Or what's your general attitude towards these firings that Trump is threatening now to exceed in the thousands? Thank you.
Well, it is unprecedented and irresponsible for the President of the United States to threaten innocent people, rather than coming to work with us to negotiate an agreement to get government open. They chose to shut down the government rather than dealing with the crisis in front of us. We have been telling them for weeks, this is how you deal with it. And I'm just appalled that this president has chosen what he has been doing all along. I should not be surprised, to threaten people, to try and make us come to an agreement that is not good for the American people.
Great. We'll move next to Ben with Politico if you've got a question.
Thank you, Senator, for doing this. My question is, Senate Majority Leader John Thune has already said he would like to, he is willing to negotiate on the ACA credits after the government reopens. My question is, in light of that, what do Democrats need to hear from Republicans on the ACA issue to come back to the table on a clean CR?
Well, for sure, we can't accept an empty promise, which is, oh, we'll deal with this later. The fact is that this crisis is in front of us now. People are getting this month their premium increases if the Senate does not act. And secondly, we've been hearing for months that they're going to get these bills done, that they're going to deal with this, and they don't. So empty promises, to me, are not a way to make sure that people in this country are taken care of.
Great. We'll move next to Riley with Notice.
Hi, Senator Murray. I'm hearing from multiple Democrats that their interpretation is a shutdown does not give the Trump administration any additional authority to reduce the federal workforce. Is that your view? And do Democrats have a plan to push back on that in court or otherwise?
That is correct. Shutdown does not give the president any additional ability to fire people or to do what he is doing today. So those actions will be taken by people who are able to file those cases in court, and we will see what happens on that. But again, he's just taking this unprecedented action to hurt people, to try and intimidate all of us who are fighting to make sure average citizens don't see their health care increases by over half. They cannot afford it. I would say to the president, you are the president, come to the table. We've been asking you and Thune and Johnson to do this for weeks to make sure we don't face this crisis we're facing now. That's what we're asking for.
Great. Nicole with CBS, if you've got a question, you're up next.
Thank you so much, Senator, for taking the call. I know Senator Round spoke to a couple of reporters earlier today following those bipartisan talks on the floor, and he basically said, quote, "It has to be done by tomorrow or things go south real quick." He went on to say that he believes tomorrow's CR vote will be critical. I don't know if you support those bipartisan talks that were happening on the floor, but how do you respond to that? Do you see it as equally critical? And then secondly, Leader Thune has indicated that it's unlikely that the Senate will stay in session this weekend. So if the CR vote fails, I assume you all will go home, but will Senate Democrats go home, or do you intend to stick around? Thank you.
I'm here. I'm ready to negotiate with anyone who comes and works with us to find a real solution to this. And I think we all are. We've been saying that for weeks, and that has not changed.
And any direct response with respect to Senator Rounds as
Look,
far as
every day
how
that
critical
goes
tomorrow's
by,
vote is? The Democrats basically need to get on board.
More and more people are going to get those notices in the mail that their health care insurance has increased dramatically. This includes our farmers. It includes small business owners. It includes many families, people who don't have insurance at work. And in the end, it's going to affect everybody's rates that are going to go up. So, yeah, every day that goes by is critical. And I hope that that means that Republicans will come to us and finally negotiate a solution to this.
Great. We'll turn next to Riley with the Washington Post.
Hi, Senator. Thank you for doing this. I actually wanted to follow up on that. Are you involved at all in these bipartisan talks about a potential solution? And could you give us an update on how those are going, if so?
Well, I'm not going to negotiate through any reporter. I will just say that all of us are trying to find Republicans who are willing to come to the table and work with us to find solutions. And there are conversations going on. We need Thune, we need Johnson, and we need the president to do the same.
Great. We'll move next to Jen Schutt at States Newsroom.
Hi, Senator. Thank you so much for doing the call. I wanted to ask what is happening in the short term on the Appropriations Committee with the full year bills. I know we've heard that you are sort of close on that first minibus. And then in the longer term, I'm wondering what you think the impacts of this shutdown will be on the appropriations process, not just in fiscal 26, but beyond.
Look, I have been deeply concerned about the appropriations process since this administration took over. They have dismissed Congress's responsibilities. They have moved funds around at will under the last CR. We have seen them withhold funds, impoundments, rescissions, all the kinds of things that really says to Congress, we don't care what you're going to do. So I've been concerned about the appropriations for a long time. What we are trying to do is get our regular appropriations bills done so that we do put parameters around them, so Congress does have the authority to say how our taxpayer dollars that we represent in our states are going to be spent. To this point, Speaker Johnson has not allowed those bills to be completed.
All right, we'll turn next to Aiden Quigley with CQ Roll Call.
Yeah, thanks for doing this. So, Republicans are saying that they are, not even willing to negotiate until the government is back open. So, how will you get them to the table, and what will change in coming days to, spark negotiations from your perspective?
Well, I find that really ironic because government's been open up until a couple of days ago. They refused to negotiate with us during that entire time when government was open. So I find it a pretty empty promise now that, open government again and we'll negotiate. The time is now, the crisis is now, come to the table now, work with us for a concrete solution, and we can get moving again, which is what all of us want to do and all of us should be doing.
All right, Tony Rom at the New York Times, you're up next.
Hey, Senator, good afternoon. Just to ask a follow-up of what you were just talking about a moment ago. Is it possible for Democrats to accept a deal here without some sort of additional language that ensures money that's been approved goes where it's supposed to go? Is it possible for you all to accept the deal just given the way that this administration has canceled funds in certain cases where it doesn't want to spend money that you've enacted?
Well, that's a really important question because I think many of my Republican counterparts would say to you, as I do, that when we negotiate spending bills and decide and make compromises, we want to know that they're going to be followed through. And this administration has ignored those and sent impoundments and rescissions and cut programs and done all kinds of things that Congress did not approve. And I think moving forward in the long run, from day now, we need to be assured that when Congress agrees on something and we make compromises, that this administration will follow the language of the law. And yes, that is part of the discussion.
All right, we'll move next to Bo Erickson.
Just following up on something you said earlier. You said you will want more than an empty promise. Does this mean you want to see new CR language? Do you want a press conference with Republican leadership? What does that actually mean in concrete terms?
So an empty promise is we'll have a proposal to you by the end of November. That is an empty promise. An empty promise is just get us going again and we'll get those bills on the floor. That means nothing unless we know for sure that our legislation actually is going to be passed and enacted into law as Congress has approved.
Go next to John with the Everett Herald.
Yes, hello. Senator, I wonder, can you point us to any studies that have shown what the effect of losing the Medicaid coverage in H.R. 1 and the ACA tax credits, what that's going to mean for the economy and productivity?
Yeah, I don't have all that in front of me right now. I'm happy to share that with you. But every study I have seen, every economist has told us that the cuts to Medicaid that were passed in the Big Beautiful Bill and the lack of extension of the tax credit and other proposals the Republicans have passed mean that many of our hospitals were closed. You just heard from two of our hospitals in Washington State. Hospitals are already struggling. Healthcare is also very challenging right now for many of our providers. Undercutting them like this means they will simply have to close their doors. Let's narrow it down to the ACA tax credit. And I think this is really important. Yes, maybe you're not on Apple Health, which is Washington State's ACA tax coverage, or other states, and you get that notice and your costs go up. And you say to yourself, I cannot afford to spend $2,000, $1,800 a month for healthcare anymore. I'm not going to get it. As you just heard from both of the hospitals in Washington State, those patients still show up in our emergency rooms. They still show up for care. It's called uncompensated care. Uncompensated care means that somebody else's prices have to go up to pay for that. Our hospitals, our providers cannot stay afloat with nothing. So that means everyone's healthcare costs go up, or hospitals close, or providers shut their doors. So it's going to be a tremendous economic impact. In many of my small towns in Washington State, the biggest employer is the hospital in that small town. If they shut their doors, every one of those people will be without a job as well.
Thank you.
All right, we've got time for another question or two in case there are any, and we'll turn to Nancy with an outlook.
Hi, Senator. Thank you for doing this. Are you and other Democrats open to some of the reforms that have been floated by Republicans on the ACA premium tax credits, such as income caps and a minimum premium requirement?
There have been ideas floated. I would like to see the language on them. The critical thing to me is that the ACA tax credits are extended And in fact, some of them I've seen, which is for people who are not over, who earn over 200,000. The fact is that 90% of the people who receive the ACA tax credits do have incomes less than 200,000. So let's see what the reality of those are. Nothing has been given to us in writing.
All right, I think that's it in terms of questions. Just give it a last moment in case anyone has one more. Otherwise, as a reminder, this will be distributed widely after the fact. And seeing no more questions, I will turn it back to Senator Murray to close us out.
Well, thank you all for your questions. We'll absolutely stay in touch. The bottom line is we're here, we're at the table, we're ready to solve this problem. We have been talking about it for weeks. All we need is for the President and Senator Thune and Speaker Johnson to talk to us, to work with us. We've had our hand extended for months. Now they just said shut down government. That is not how you solve problems in America. We're here. We're ready to work on this.